Hello everyone, Mark Hackle, Macomb County Executive. What we wanted to do is give people an understanding of what's going on with the CARES funding, in particular how it impacts Macomb County. Now we were fortunate, obviously Congress had passed some funding, and again it was about $2 trillion worth of funding for this what they call the Coronavirus Aid Relief Economic Security Act, and some of that funding was kind of a push, if you will, relief fund that went to some states, various U.S. territories, and as well as some eligible municipalities. And what do we mean by eligible municipalities? Well, about $150 billion went to what we consider obviously states, U.S. territories, and some counties and or cities that had a population of over 500,000, 500,000 or more. Macomb County happens to have 877,000 people, so we qualified. And with that funding here in Macomb County, we got $152.5 million to try to figure out how do we spend here in Macomb County, but it's all guided based upon certain parameters actually in the act itself. So what we're doing today is just going to update people as to what we plan on doing with those fundings, again, as specified by the parameters that are put forth by Congress. So we do want to take a moment, if I can, to thank our congressional delegation, obviously Paul Mitchell, Andy Levin, Debbie Stabenow, and Gary Peters for their efforts to try to figure out how do they help us during these incredible times dealing with the coronavirus. And I do say it's been an incredible impact here in Southeast Michigan, the state of Michigan, but in particular Macomb County. To date, we have registered 6,425 cases in Macomb County. So 6,425 people have tested positive for that, and with that, the deaths were actually 741 as of today. Fortunately, we're starting to see a decline, an incredible decline, yet we still know there are people out there getting sick, and there's still people that are, dying as a result of this. So with that, we want to kind of update you on what we're going to do with that funding and why. Well, if you stop and you think about it, $152.5 million is pretty substantial, especially if you take a look at our general fund for the county operating budget each and every year. Our operating budget here in Macomb County is about $270 million, 278 to be more precise. $278 million is what we're dealing with here each and every year. So you think about it, this money that we just got is almost over half of what we have for our general fund. So we've decided to try to work with our emergency management, our finance department, even our auditors from Plant Moran, to try to get an understanding of, okay, what are the parameters actually as laid out by this, and how do we get the funds to the proper areas sooner than later. So we got the funds, they came to us, I mentioned April 24th. We worked feverishly to try to figure out how do we actually find the best allocation of this, and we came down with certain areas that we have identified as the areas we want to figure out where we deal with our pools of money. And you can see that behind me here. Recouping and prepare about $24 million. The Public Health Department and what we're doing with public health, about $32 million. Supporting our local municipalities, about $10 million, and our vulnerable populations is about $16.5 million. But the vast majority of that funding is going to be to support our small businesses that have been incredibly impacted by this. And so I'm going to get kind of specific in each area just to kind of identify what we're talking about with that. When we talk about recoup and prepare, obviously there were labor cost issues that came into play. We're trying to figure out, facilities that we have in the county. How do we manage and what are we doing with the protection that is necessary? Currently today, once this incident happened here and it kind of impacted Macomb County, we immediately told our folks they got to work at some remote locations. We try to figure out how do we get people social distancing by getting out of the building. So today, only about 20% of our workforce is actually in the county buildings or offices. We've never shut down. County government has never stopped. We've never shut down, but we did work with our IT and various department heads as well as the support from our countywide elected officials here in Macomb County to get the folks spread out so that they could work at remote locations, and again, using some of our IT services. So there were costs associated with doing that, but again, to protect our staff and obviously protect people that were still coming into our buildings. So with that, some of the funds that we're talking about in the Recoup and Prepare are going to help us deal with those issues as how it impacts our budget here in Macomb County. The public health, as you well know, trying to figure out how do we deal with the testing, number one. I mean, that is a big deal. PPE, trying to get those to our supporters in the medical field and our first responders. Martha Cheeberry was needing some support, and as well our county morgue. So that and testing as well as contact tracing have been an incredible challenge for us with our health department, but again, no different than what we're seeing across the state and probably around the country as well. Our local partners, local municipalities, there are 27 municipalities that make up Macomb County. We know there's funding available from the state that's going to support that, but we thought, we're going to add to that as well. There's going to be an opportunity for them to, if they qualify for certain, I guess if you will, expenditures that they've made, to try to get reimbursed for that. Each one of those municipalities is going to be able to go ahead and apply for the grant funds that we have here. Now understand, each and everything that we're doing has to be audited. So we can't just take the money and just say, here you go to a local municipality based on population is basically what we're doing, their allotment. But again, they're going to have to submit to us what their, if you will, requests are to be recouped for some of those costs. And we have, as I mentioned, about $10 million in there for that type of support. Our vulnerable population, I think everybody realizes, they're the ones that are most impacted by this. We are trying to figure out how do we best allocate some funds for them to support our seniors and even our schools. And some of those kids that are not in the schools are in need of some support, specifically dealing with some of the meals and the food that we provide them. And we've had a great working relationship with all the school districts in our ISD here in Macomb County. This is going to be working in partnership with them to try to figure out how do we do that, as well as our senior division here from our Macomb Community Action. And now I want to get to small businesses. Small businesses. We're getting to a point where I think you're going to start to see more movement on allowing these businesses to get back up and running. We are prepared and have been. Not only do we have a business plan at macombgov.org, and I share that website with you because it's a tremendous amount of information about what's going on here in the county on a normal basis. But boy, I tell you what, we've done a great job, an incredibly robust website for people to understand what's going on dealing with this coronavirus and updates as well. So it doesn't just have the statistics, but information. And one of those is the business resource icon that people can click on if they're a small business owner. What is a small business? Anyone that has less than 500 employees in their facility or working there. So we got about $70 million that we're going to, in phases, try to get out to them and to try to figure out how do we support some of the challenges that they've had during this crisis. But one of the things we've already been doing with the funds, and we've already been allocating some of these funds, is working on some of the, if you will, care packages and again, our starter kits, trying to get them prepared because they're looking for PPEs, they're looking for gloves, they're looking for some type of support with face shields when they get up and running to meet and I guess, if you will, exceed not only the CDC guidelines but even some of the executive orders. Because I believe our partners here, our business partners, want to be part of the solution. They always have been. If you remember when we decided what was essential and not essential based upon some the state mandates and the governor's executive orders, they complied. They got on board and they realized, we got to flatten that curve. They did so. Many of them are looking to get back up and running, and understandably so, and they want to do it in a safe manner. We're going to be working with them to try to figure out how do we support that if and when executive orders allow them to do so. So again, behind me, this table here just kind of shows a few of the items that we're going to be prepared. And so each one of those, I guess if you will, businesses, when they come up and running, are going to be able to contact our planning department to get themselves the available, I guess if you will, PPEs so they can get going. I want to caution, whether it's local units of government and or small businesses, we're going to have, this is just giving people an understanding of how we're going to be expending these funds. These are the areas that we're targeting right now. But all the plans are still being worked out, and probably the first part of June we're going to have another announcement as to when people can apply or small businesses can apply for these funds. And the same with local units of government. Our emergency management team here has done an incredible job. Vicki and Brandon and their team have done a great job of working with our local units of government from day one. And with that being said, I'm going to let Vicki talk just a little bit. This is one of my deputy executives here, Vicki Wolbert, who used to be in charge of emergency management, is now one of my deputy executives, who's kind of been running the show here from day one once we instituted our emergency activation here in our contact center. So Vicki, if you want to explain a little bit about some of the funding and what we're doing in some of those areas that you're responsible for, please do.
Thanks, Mark. We're on day 69 for our, since we've been activated and dealing with the coronavirus within the county. We've made great progress and we're very thankful for the CARES Act funding that has come to us. $152 million, it's a lot of money, a lot of different areas. We've had very creative people working on our team to help with projects that we've come up with. And as Mark said, just to expand somewhat on some of those projects and what we're doing, if you look at our IT component that is part of the recoup and prepare category, some of those specific items we're looking at is the remote working. We have employees that we're able to quickly get laptops to, but now we want to look at that longer duration. How many people can we have continue remote working? Is that a better plan for the county moving forward from an efficiency standpoint, and maybe start trading out some of their desktop equipment? video conferencing, many systems out there that we've been able to get up and running. But there's enhancements that we can make to what we're using now so they're more permanent. When you look at Comtech, even in the great facility that we were able to build here, there's things that we've realized now that we've been here for almost 69 days where we can make improvements, whether it's through our video wall or some of our public information, how we interact with the media. So we have some plans for that. The facility protections, how do we keep our employees and public safe? How do we still do in-person business for those people? So right now we're going through surveys with our individual departments and saying, what do you need when you come back and you have people here? Are you going to need physical barriers? Maybe it's just signage, maybe it's markings on the ground that we can help with to make the public and our employees feel safe. When you look at our public health categories, he talked about testing. That's a large component of where we are, and that has to do with not only supplies and contracts with labs, but with people. We have plans underway right now to partner with local EMS agencies and have them partake in our testing, whether it's in long-term care centers or congregate care sites. The personal protective equipment is probably one of our largest items so far, and that's, again, taking care of our employees, making sure they're safe on site, as well as if they're working in the field and going out to any of these congregate care sites. One of the things, the morgue operations that we identified as part of this process, unfortunately, is our morgue capacity is not enough. Fortunately, we did not necessarily exceed that capacity with our partnerships with our local hospitals and other entities, but we realize that's an expansion that we really need to make and expand what we're doing there. And then when it comes to the local municipalities, we realize we got this large sum of money, and then they were not fortunate enough and to be part of that and have their own allocation. So we realized a lot of expenses that we've had to do as a county in response and taking care of the community and our people, they have those same type of expenses. So we'd really like to pass that along to them, and we've provided for allocations and a process for that. Some of these projects that we have in mind are very short duration. We can get up and running quicker than others. So that is how we will prioritize too as we go through these. Mark mentioned, early June with some of the business packages, same thing with the local municipalities. We'll probably be able to get projects like that up and running and out the door quickly, and consistently monitoring where we're at with the projects and what are our funding sources. And maybe, we'll have to be able to pull in some other projects. Maybe some will have to wait as we work out those details. But we're very excited as we move forward and the opportunities that this funding can bring to us to, again, making Macomb County a safe community, having us be proactive, and really taking care of everyone, including our employees and citizens.
Thanks, Vicki. And as you could tell, this is her expertise, her background, obviously crisis management and emergency management from day one. And when I say day one, we recognize in the country the very first case was in the state of Washington on January 21st, recorded case, if you will. And then obviously closer to home here in Wayne and Oakland, they recorded their first case on March 11th. And then shortly thereafter, we recorded our first case on March 13th. We didn't wait for our first recorded case because even our health department said they were very certain there were people that already had the coronavirus that probably would have tested positive prior to that recorded case on March 13th. So our officials got on board right away. We activated the emergency management. Vicki and her team, along with Brandon, did an incredible job of trying to figure out how do we reach out to local units of government to make sure that they understood, we want to be that conduit. We want to be their partner. And once we did, twice a week we're having contacts and, if you will, communications with every one of the municipalities here in Macomb County. They have somebody who's assigned as a direct contact for Brandon in our emergency management, and they've been working with us. But let's suffice it to say, one of the big concerns everyone is having right now, especially if it's a unit of government, local, county, state, or federal, is funding. And this is going to be an issue moving forward. So again, we can't thank enough our congressional delegation and the support of this funding coming our way. $152.5 million is very substantial. And with that, we're going to be very precise on how we expend those funds and making sure that obviously everything is audited so that we meet all the parameters that are laid out based upon the act itself. So with that, I thank Vicki and her team. Now I want to bring up JP, one of our other deputy executives, John Paul Ray, who is going to kind of update us a little bit about what's going on from the health side as well as the business side. John Paul?
Thanks, Mark, and thanks, Vicki. I think it's been an unprecedented challenge across our community and state and country. However, with this injection of federal funds, it's given us an ability to modernize our operations and invest in systems in those core critical areas in our community that need the support. One of the first ones that came up in our preliminary conversations was the vulnerable populations. Undoubtedly, the senior community, the impact that this has had on individuals that are in the later stages of life was an arena that we not only had a tremendous amount of analysis from our public health sector, but also from our community action agency. Our OSS division was able to scale up everything from Meals on Wheels services, congregate dining services, senior care packages. We've developed these systems and given us an opportunity not only to engage seniors just with basic welfare checks, but also ensure that we're also bringing in our partner agencies and other service organizations, whether it's the Area Agency on Aging or the United Way for Southeast Michigan. There's been an unprecedented amount of analysis in this sector to ensure that we're engaging our senior community, but I think most importantly to ensure that we have a long-term system to ensure that care is there. That interaction and case management is going to be absolutely critical. The other component is the educational sector. Clearly, there was a challenge with schools being closed, but as Mark and Vicki have both highlighted, we've been in continually conversation with Mike DeVault and our ISD, our local superintendents and local districts. We're in continued conversations with them, doing weekly check-ins on everything from operations, digital learning environments, and everything that's needed specifically with regards to the food delivery services. Every single one of our school districts was able to step up, provide emergency food resources for children and their families throughout our community, and I think most importantly, it gave us an opportunity to connect and really know where that need was. Moving forward, we're also looking at what we are looking at with the return to learn strategies that the state's discussing, how that impacts our local districts, and what type of resources will they need, whether it's developing more robust digital learning environments or providing PPE equipment and other type of things to ensure that we can bring back facilities safely. On the small business side, that's probably been one of the most interesting arenas where we've engaged the private sector. As Mark has said a number of times, undoubtedly we have a public health crisis, which collectively we're looking at, but we're also looking at an economic crisis. Over 1,200 businesses have been counseled by our Planning and Economic Development Department since the onset of the coronavirus. What that has done is it's given us the ability not only to inject resources that we received through the Michigan Economic Development Corporation with the Small Business Relief Program, but with this additional pool of money, we're looking at phased opportunities to deploy everything from survivability loans that will go, grants that will go to businesses, and also sustainability funds when we look at the summer months and in the fall. This type of programming is being developed in a dynamic framework in which we're getting information, what are some of the businesses' needs right now, and that's how we looked at developing the support packages that can get businesses up and operational, not only with this initial rush that comes back on board as the governor's issuing new executive orders, but again, as we're working with our local chambers and also with industry groups to understand what their needs are going to be moving forward. It gives us a great opportunity to ensure that we're really supporting those businesses if they've been met with a challenge that none of us knew would ever come down the pipeline here. But I think that we have a tremendous amount of resources here that we can develop in a very nimble way to get to local businesses that are going to employ individuals throughout our community. Thanks, Mark.
Thank you. Thanks, John Paul. And obviously, JP, his team, our health department folks, incredible work that they're doing right now. Just to update real quick, as far as the work they're doing, the contact tracing has been probably the biggest challenge for them. They got up to 60 people now doing contact tracing on a daily basis to try to figure out once somebody is testing positive, how do they follow up and make those calls and find out who else they may have come in contact with to get them to self-isolate. So they've done a great job. Vicki Rad has done an incredible job with our planning department as a result of not being able to do a lot of other things that they normally do. Now the focus is on how do we get businesses prepared and how do we help them take care of some of their economic challenges that they've had, because let's face it, as John Paul had mentioned, we've got two crises going on at the same time. The health crisis, fortunately, all the good work that people have been doing, whether it's the governor's executive orders, stay home, stay safe, shelter in place, has had an impact. People are weighing in on it, they're supporting it, and even the businesses. So with that being said, the health crisis, we've been able to kind of, I guess if you will, focus on that and flatten that curve. And now the next crisis is what we've been talking about, is the economic crisis. And we want to figure out how do we get them back up and running, and if and when they do, we're prepared to try to figure out how do we help them. So what's next? We are allocating a lot of those funds. We're already moving in that direction. The state of emergency gives us the ability to be a little bit more fluid with what we're doing, but everything needs to have a check and balance, and we still run everything through the board as we are doing it. Even our auditing firm is going to be keeping close contact with this $152.5 million to make sure it's all within the parameters. We will be sending Thursday a budget amendment to the Board of Commissioners, as well as seeking another extension for our emergency order here in the county. And we do believe, obviously, there is a need to do that. Why? Well, because it gives us the fluidity, the ability to get the funds out there, but it also provides us an opportunity, if there are more funds available, for us to be able to accept those, knowing that we have declared a state of emergency. So, with that being said, it was just a quick update, if you will, on what we're doing with the CARES funding that have come here to Macomb County, and kind of let people understand exactly where the areas of concern we have and how we're going to use those funds. So I'll open it up to some questions. We do have a few media that are here that are available for questions. So.
The $70 million that's going to the small businesses, is that in addition to funds that CARES money that they've been able to get on their own? Or is this on top of it, or how does that work?
Yeah, how does the $70 million? And I'm glad you brought that up, because I want to make a cautionary note. We don't want, after this press conference, all the businesses in Macomb County calling us. I kind of said it earlier. I want to make sure they understand there's going to be phases that we're going to be moving into, directing them as to how to get a hold of us and contact us for what might be available to them and for what purpose. So, John Paul, if you want to kind of hit some of that. I don't want to get too far ahead of it. But
So the initial funds that were available came through the MEDC with the Small Business Relief Program. There's about $800,000 that the county received. Businesses themselves have been able to get the Small Business Association PPP grants and loans that have been coming down the pipeline. But this is additional funding that was awarded to the county, in which, under the parameters that were set forth in the CARES Act, there is stipulation that allows the county to deploy resources to businesses in response to the coronavirus.
And so understand that first amount that we had, $800,000 from MEDC, $100,000 from First State Bank, kind of combined, working with our chamber partners, we had to make an assessment as to how to take care of that need. That really, I mean, we're thankful, but really that was not a lot of money to try to figure out how do we deal with all business concerns that we're seeing out there right now. So, $70 million is going to be more substantial, and exactly how we're going to allocate it, we'll be more specific about that as we move forward. But again, I want to caution businesses from calling our planning department, lighting them up. They don't have callers standing by right now, and by calling or emailing doesn't mean that you're ahead on a wait list. That's not how it goes. We're just going to tell people that call us right now, you're going to have to wait the announcement and or check back with us once we do this. And it should be the first part of June is when we're anticipating more information specifically about how we're doing it. Today, I just want to give people the understanding or heads up. We got a lot of money, as I say, well over half of our normal general fund budget. That is a substantial amount of money. With that, I want to make sure, as transparent as we can, let people know we plan on getting that money out there into the hands of the folks that need it sooner than later. And these aren't, as I mentioned, loans, these are grants. So these are opportunities for them, something that they're not having to pay back. And that wasn't the intention of the Congress, even or the President when they signed this act. It was to get that relief and that support to local communities, as well as our businesses.
Is this almost too much money? I mean, it's a lot of money. Like you said, it's more than half the...
Well, the question is too much money? And the expenditure right now has to be by December 31st. We're working with our congressional delegation to ask for a little extended period of time. What do we mean? We kind of would like to see that if they declare as the executive of the country, the president decides to say, we no longer have this state of emergency or declaration in place. Maybe from that point forward, maybe a year from that point forward is when we have to have these expenditures. And I say that because what would be really nice, and I'll just put it out there, is if we could use some of these funds for capital improvement of projects such as our health department, so that if and when another pandemic or crisis like this happens, that we have a facility and staffing that can handle anything like and similar that might come our way. So we are trying to be creative in that fashion. That's why I say these are kind of assumed amounts, because if we're given that latitude down the road, for some reason we're trying to work with our congressional delegation to get them to support this. We think we could do something that is going to have even a greater impact in the future, not only currently dealing with the crisis, but into the future of being prepared to handle anything like and similar as well.
Can you talk about the initial influx of money? You said in June, because some of these businesses probably are teetering on whether they're going to stay open or not. Some of these businesses may need this money like right away. So Is
Yeah.
there a way to fast track it?
And the question was, you know, they got businesses that are teetering on this. They need it fast track. They need to move on this right away, and we agree. You know, we had obviously the approval, or the money actually came to us, our finance department, through the treasurer here in Macomb County on April 24th. So in a very short window, we had to work with our finance department, our planning department, folks from emergency management, even our auditors, to try to figure out exactly what does this act provide us the opportunity to do with these funds. How do we want to play it? How do we want to lay it out there? What would be the best areas of, you know, I guess if you will, financial support? And with all that being said, this is why we're here today, because last week we finalized that, and we figured we might as well let the public know where we're headed with this. But all the details in that are still going to be pending. You know, we're going to start expending some of that. In fact, we are working with some of our local partners right now in utilizing some of those funds. There still has to be a formal, I guess if you will, adoption of the amendment on behalf of the board, but you're 100% right. There are businesses that want this now. A lot of them want to open their doors, and I'm just going to say this, if I may, kind of my editorial moment here. Businesses want to be part of the solution. They want to be a partner in this, but they need to find out as soon as they can when they're going to be allowed to do so, no matter what business it is. We're opening certain sectors, but many of the sectors are still being left behind, and it's critical. I mean, they're at that critical point right now where they need to know, am I going to be able to open, and when am I going to be able to open? And that's, I think, the biggest concern they're having right now, and rightfully so, because it's a question as to whether or not they're going to be able to stay in place, even if they decide they're supposed to open. So many of them may say, you know what, we still don't feel comfortable, we don't want to. Or maybe the public may say, you know what, even if they open, I'm not going. And that's okay. We still want people to shelter in place. If you don't feel comfortable, you're elderly, or you've got some kind of health issues, I think you should kind of prolong going to a restaurant, going to a health club, going and getting your hair cut someplace. I think you need to prolong that. But businesses are saying, we want to do it, but we want to do it in a safe fashion, because we want to be part of the solution. And if we can help them prepare, as I mentioned, macombgov.org, where we have an icon there for the business preparedness, as well as these packages of support that they can have with PPE equipment, and even work through them some other, I guess if you will, logistics in their facilities to help guide them and get them ready. I think they're all willing to not only follow CDC guidelines, even the governor recommendations from emergency orders, but even the support that we may give them to exceed some of those restrictions or requirements.
Do you have an opinion on when the governor should move and start opening businesses in Southeast Michigan?
You know what, I support if and when she does it. My only concern is, you know, letting them know what that parameter is. I think that's the biggest concern people are asking me constantly is, you know, what is your angst or what is your issue with the governor? I don't have an issue. I don't have an issue with when she opens. I would support, you know, opening them. My bigger concern is, what is that threshold? You know, because that's what the businesses are asking us. When are we going to know? What does it take? What is in the numbers? You know, we just opened up part of the you know, the northern part of the state. I think District 6 and District 8 were opened up. The question is, you know, what was it that we looked at in those numbers that gave the okay, or gave the feeling of comfort to say we're going to open up in that area? What was it that allowed us to open construction, or even some of the manufacturing facilities here, you know, suppliers? What was that? Because, you know, the barbers, the restaurants, the gyms are looking for that same, I guess if you will, criteria. So they have an idea, are we trending in that direction for that final approval to say you can open? But they're prepared, and I think they'll do it in a very precise way to try to figure out not only they safeguard their employees, but safeguard, obviously, patrons that might want to come into their facilities. So, are there any other questions?
One more. Do you have a plan for how much would go to contact testing?
Specific amount? No, but it will be
increasing it. Do you think it needs to be increased? You said there's 60 contact testers that have been trained.
Yeah. The question is about contact tracing. Early on, we were able to handle the first few cases, and all of a sudden we had just an influx of test positives. And when that happened, you know, I think everybody was, not want to say caught off guard, but understaffed to try to figure out how do you do it appropriately. So Bill Rodella from our health department, Dr. Lokar, did a great job of trying to get people and recruit. And in fact, we reassigned people internally. I mentioned 80% of our workforce is working at remote locations. We had people volunteer from various departments to support other things, Meals on Wheels programs, trying to figure out how do we deal with our food warehouse, and in particular dealing with contact tracing. So Bill has been working with those folks, and even support from the state, and ramped up to having about 60 people doing contact tracing. So to answer your question directly, I already asked that question to Bill. He says we're satisfied with the 60 right now. We can handle the workload, and they're doing an incredible job with that. But again, if we do see a resurgence coming up, it's time to pull back on whatever we opened up in the economy. And obviously, if Bill needs more staffing, we will try to provide that for him for contact tracing.
What's the end goal of the contact testing or tracing?
When you say the end goal, I don't know if there's an end goal. I think it's a responsibility to try to figure out how do they, the question was, what is the end goal of contact tracing? Contact tracing simply it's kind of like a law enforcement investigation. You found out somebody tested positive, making sure that they're staying sheltered in place, and trying to find out who they may have come in contact with, where they may think they may have contracted this from, and or who are the people that they may have been around, so we can contact those folks and let them know as well. So it spreads out. So the goal of it is to let people know somebody that they may have come in contact with has tested positive with this. And I guess if you want to say there's a goal, the goal is where we don't have to do it anymore. But I don't know that that's I don't think that's anywhere in the near future. From what I'm hearing from experts, is this may be going on for the next year or two, for it's really starting to settle down.
Mark, there's another question from radio. Can you elaborate on item number 1, recoup and prepare, what that means, maybe some items?
The recoup and prepare, again, recouping our costs for our IT services. What we've done with some of the labor costs associated with this. What are we doing as far as facility needs? Vicki, I don't know if you had a few more things you wanted to add to that. Recoup and prepare, even the testing that we're trying to do. Trying to figure out how do we do more testing. There's a lot of issues that go into that.
Right. Now, a lot of things do fall into that IT realm, and again, that's the video conferencing we talked about. There's cloud services out there that we have not participated in previously, just because we either didn't have the infrastructure for it, or people weren't comfortable maybe with using those services out in the cloud there. So those are some areas that we're looking at for that. Facility protections, we've talked about maybe changing entryways even for how employees enter the building. How does the public enter the building? Where do they come through? So that's all about that preparation and that recouping, and some of it even goes into the whole mitigation. How do we better prepare ourselves for if or when this happens again? What high-level changes and maybe some very specific changes can we make within our facilities, again, going back to the long term, that we can do to protect people, and so that if that happens again, they're not as vulnerable to something like this virus that is going on. So those are some of the other items that we can do and partake in when we're looking at the preparing ourselves for the future, and then also kind of looking back of where we've been and what have we expended so far.
And in the PPE, trying to figure out how do we stockpile. Well, that was a big problem early on. There wasn't a stockpile of PPE, and nobody seemed to know where to get it from. And fortunately here in Southeast Michigan, we went from arsenal of democracy, arsenal of innovation, to arsenal of health. We had a lot of these manufacturing companies that were shut down because they couldn't do work, but retooled themselves to figure out how do they make masks, how do they make face shields, how do they make ventilators. I mean, even the gowns. It was amazing how they were able to retool in such a short fashion. But they did so because we didn't have enough. Well, this next go around, if there is such a crisis such as this, we want to have a stockpile available, not just for our purposes here as a county government, but obviously first responders in our healthcare facilities. They were begging for these type of supplies. So that's going to be one of the added costs moving forward, is making sure we have an appropriate stockpile based upon what we believe another need may be. So, any other questions, concerns? Right, I just want to thank the media and folks for tuning in, and for those of you that are watching and paying attention. We appreciate your efforts to do what we've asked of you to do, and that's basically stay home, stay safe, shelter, that social distancing, wearing masks if you have them available, within 6 feet of somebody, make sure you have it on, and again, continue to keep you and your family safe. Thank you once again.